welcome to the fourth instalment of my weight loss journey. So this episode we are going to look at the common side effects of weight loss injections, in my case Mounjaro. Now, a strange thing, YouTube and Google don't like references to Mounjaro because it is a restricted drug in some countries. So I'm going to try and just keep my references generic, but you know what I'm taking. So we're going to look at my first 5 weeks on the medication, specifically focusing on the side effects. So as with any medication that you get, you'll always receive a leaflet. Many of us don't even bother reading it, but the contraindications. So that is an extensive list of all the potential side effects and indeed what you should do if you suffer from any of them. The reason that they are so extensive is part of the production company's risk management strategy. And at first glance with any of them, they can seem scary or put you off. So I suppose the big question is Mounjaro safe? Well, it's been approved for use in the UK by the Medicines and Health Regulatory Authority, also known as the MHRA. This means that it's been deemed safe for use in patients who are prescribed by a registered health practitioner. So that could be doctors, pharmacists, online pharmacists. So from listening to the experiences of others in the forums, coupled with my own experience, these seem to be the most common side effects of Mounjaro. So there are a few listed here, as you can see. Now I'm just going to change this and show you the ones that I have suffered from. So those are the ones that are underlined here. Now, before I tell you how I manage these issues, Mounjaro themselves do say that the most common side effects should clear up on their own once your body gets used to the treatment. If you are struggling to manage or experiencing any severe symptoms, it makes sense to speak to your doctor. Side effects will obviously vary from one person to the next, and you might not experience the same things I have, and vice versa. The best way to manage side effects is to know what they are and what to do about them. So prescribers reduce your chances of getting side effects in the first place by gradually increasing your dose so that your body can get used to the medication slowly. That is why everyone always starts on 2.5 ml. You can go up in 2.5 ml increments each month, but some people just maybe get to a certain dose and then maintain on that. It is also worth reiterating as well that it's really important to tell your doctor or your prescriber about any other medications that you're taking, because some might react or interact and could impact the effectiveness of other medications that you take or with your weight loss drug. So how long do Mounjaro side effects last? Well, again, this can differ from person to person. There's no set time that they're going to last, but mild side effects are likely to go away within a few days to a couple of weeks as your body gets used to the medication. You're most likely to get side effects when you first start taking it or when you increase your dose. Again, this is because your body needs time to adjust to the medication and any changes. Fortunately, my side effects were pretty mild and I was able to manage them at home without any input from the doctor. So the side effects I've suffered, let's just look at these individually. So initially I suffered from quite a bit of stomach discomfort. So I have to say that for me it's just a case of old habits die hard. For too long I've eaten far too quickly, effectively hoovering food up. And as soon as I started on this medication, I felt full really quickly. So the biggest adjustment I made, and one that I would recommend, was to eat more mindfully and eat more smaller portions that are calorie controlled. Mindfulness is your friend, so enjoy food, don't inhale it. Next up, I did feel quite nauseous. Now, I wasn't physically sick, but I controlled the nausea by drinking lots of water in small amounts. I also had a cup of peppermint tea each day. I found that fresh air was a good way to help, as was distraction. So, if you can, maybe watch a bit of TV or listen to some music and focus on those things rather than the nausea, it does actually help it to go away. So again, make sure when you're eating that you do it mindfully, so you can recognise when you are full. Other things that you might try if you're feeling nauseous, try avoiding fat or fatty foods, eat smaller, more frequent meals, eat bland foods like toast, rice and crackers, and also food that contains ginger. All of these are great wee tricks. The next symptom was constipation. So I actually believe that constipation was an issue for me due to the 3.5 day egg fast that I undertook quite early on. So although eggs are rich in protein, your body also ideally needs a good fibre intake, without which the risk of constipation does increase. Now, I experienced quite a bit of pain. It was like passing rocks, and I had a bit of bleeding, which was not fun, I can tell you. I'd recommend that anyone going to undertake an egg fast, try and have quite a high fibre intake before you start your egg fast and immediately thereafter. This symptom for me disappeared within a couple of days of finishing the egg fast, hence the reason me thinking that those two things were linked. If you do experience constipation, there are several things that you could try. So make changes to your diet, try and make it healthy and balanced. Eat a lot of fruits, particularly those that contain sorbitol. So that's things like grapes, raisins, apricots, apples, raspberries and strawberries. Try and include some wheat bran, linseed or oats in your diet. I eat quite a bit of porridge, so those types of things help. And gradually increase the fibre in your diet till it reaches that healthy level. Again, if you are experiencing constipation for more than 2 or 3 days, try raising your feet when you go to the toilet. So rest your foot on a stool or a couple of books, whatever's handy. Also try increasing your physical activity. So even if you're exercise restricted, things like stretches can help food move through your digestive system, and there's always plenty of these types of exercises to be found on YouTube. Laxatives should be the very last resort, and speak to a pharmacist before you take laxatives as well. You should also go and see your GP if you're regularly constipated, regularly bloated, and have blood in your poo or experiencing stomach pain. So diarrhea was another one I experienced, polar opposite there. I really only experienced this once on the 2.5ml dose, and that lasted a couple of days. I overcame that by just trying to stay hydrated, drinking plenty of water. I also avoided spicy food for a few days as well, just to let the body adjust. If your diarrhea lasts for more than 7 days, or if you notice blood in your poo, then please seek medical advice. Talk to your doctor if you have side effects that bother you or don't go away. The biggest side effect that I experienced, and the most common one, was heartburn. So I suffered this the most. While you can take things like Rennie's, Gaviscon and omeprazole, these are really only intended to be short-term solutions, and they can be quite expensive. So I went for the more natural home remedy of just gargling warm water with bicarbonate of soda, and it was pretty effective. I also found that heartburn became less of an issue since I moved up to the 5ml dose. So beyond that, most side effects of Mounjaro are mild and manageable, but in some cases there can be more severe side effects, and some that are very rare, only affecting less than 1% of patients. Those might include low blood sugar, or hypoglycemia as it's known, inflammation of the pancreas, gallbladder problems, low blood sugar. So for any of these, you should definitely seek urgent medical help. Now, allergic reactions is something that's always a risk when you take any new medication. So it is uncommon, but some people can be allergic to Mounjaro or other weight loss jabs. If you have any symptoms of an allergic reaction, stop using the medication immediately and seek emergency medical attention. So some symptoms of allergic reaction might include swelling of the face, tongue or throat, problems breathing or swallowing, a severe rash or itching, fainting or feeling dizzy, fast heartbeat, and angioedema, which is a rare but serious side effect of Mounjaro. This is where your skin becomes swollen, mostly happens around the eyes and mouth. If you notice this, again, stop taking the medication and seek medical help right away. When you do stop taking your weight loss jab, they're mostly not known for any withdrawal symptoms. It can take about 25 days for the medication to completely leave your system after you stop taking it. So any side effects are also likely to go away during that time. Once you stop taking the drug, the effects will also be reversed. So this means that your blood sugar levels are likely to return to the level they were before you started taking the medication. One study that I read found that people taking Mounjaro regained up to 1/3 of the weight they lost after stopping. This is one of the main reasons you should not rely on weight loss jabs alone, but take the blended approach like I'm doing, and this will help you remain at your ideal weight. In theory, if you are eating much less over 6 months, your stomach should shrink. Remaining committed to mindful eating will serve you really well. And keep going with the calorie counting and get some exercise. And all those things will help you to remain at your ideal weight. So I hope this video has given you some insight and been useful. Please like and subscribe. That really helps your YouTube algorithm. Click the bell icon for notifications of new content, and also share the content with anyone that you think might be interested in losing weight. I want to say thanks for watching, but I also want to say thank you for donations. So there are 2 shout outs that I want to make just now, and that is for Mick in Detroit. Thank you so much, really appreciate you. And also Carolina in Michigan. These donations help the videos to carry on, so really appreciate you. I appreciate all of you for watching, and I will hopefully see you on the next one. Meantime, drink plenty of water.